Before launching Lume Health, Vicki was an engineer at Apple, developing the next generation of sensors at Apple Watch. She holds 3 patents in wearable sensing. Today, she's building what no one yet has built, which is a continuous hormone monitor wearable, starting with cortisol and circadian rhythm. So Lume's ambition is to make the invisible visible, translating the body's most powerful biological signals into real-time actionable data. So, Vicki, Lume focuses on cortisol and circadian rhythm. So, I bet there are a few of these non-sustained high-performance people running on poor sleep and adrenaline. So, what would the hormones tell us that we don't really know, and how are you approaching that? How are you using that?
Yeah, that really resonates with a lot of what we're uncovering at Lume. Honestly, we're seeing a lot of this. A lot of our early users are actually founders, and a lot of VCs as well, actually. But cortisol is a really great marker for uncovering some of that behavior that leads to things like burnout or poor recovery. And the fundamental rhythm that governs cortisol is actually called your circadian rhythm. And a lot of people have heard about it, but it really is this balance between rest and activity. And it's ingrained in every single cell in our biology. And it's governed, a lot of people are surprised to know, but by sunlight. We evolved for millions of years, not just us, but plants, animals, single-cell organisms in the light-dark cycle. And it shows up very clearly in our hormonal rhythms. So that's one of the things that a lot of people are finding when they start using Lume or experiencing Lume is they start to understand that they're not a static being, but they're a dynamic, moving biological system, and that if you don't enhance and really pay attention to that rhythm, you can end up burning out. And that's where we see a lot of people with chronic fatigue, insomnia, not able to sleep and not able to perform at their best.
With all the new technology and what's changing in the technology environment, in the data environment, also certain aspects of regulation or lack thereof. How are you thinking about making use of and integrating and merging all the new technologies together with what we start to know about all the connectivity between brain, heart, hormones, and how you're thinking about innovating in this enormous shifting environment?
Where we sit, we really see one of the bottlenecks is that data. You know, we can't build better models without better data. And earlier today, we were hearing a lot about friction and how friction is often something that holds back really great kind of discoveries. And in healthcare, there's been a lot of friction to get data today. I mean, talking about hormones, you have to go to a lab, get a needle, they draw it out of your body, they then send it to another lab, it takes 2 weeks, and then you get the data back. So just one data point. And as we all know, our hormones are fluctuating minute to minute, hour to hour, every day. So like we were talking about earlier, if you're just taking these snapshots, it means nothing. So any model you try and build on the existing framework of hormone data is not going to tell you anything. So that's really where we see the opportunities. If you can provide people with tools that can collect this novel data, you can now unlock AI in a way you could never before. And we really see, one of the sayings I say is a lot is, you got to feed the beast. And you got to find data to feed the beast. We've seen in a lot of industries before of this decentralization of healthcare, where now it's going to be owned by the individual and driven by the individual. And I think the centralized system is quite excited about that, to be unburdened by some of the lighter weight tasks that can be managed by the individual. So yeah, it's an exciting time.
I'm glad you made a comment actually about the ownership of the data. It's something I'm really hopeful about as well. If you each were to pinpoint a specific either technology or habit or shift in healthcare that would really have a massive impact on our health span in the coming 10 years, what would that be?
I mean, aside from what we're building, I think honestly thinking a lot about how potentially blockchain technology can create an incentive system that can unlock a lot of value in the healthcare. So I imagine, for example, if you own your own wearable data and you can contribute that data to a centralized clinical trial and be rewarded for that through providing your data, I think that could really provide a lot of energy for and value for how the system needs to transition.
Yeah, it's a very exciting time, I think, for preventative health, and the ability to crunch huge amount of data is critical for a very complex system, which is our human body and mind. So thank you very much. It's been a delight.